Good morning, everyone. Good morning, my friends, ladies and gentlemen. So, I am Leia Panur, and this in line of our subject, GE20. So, I am going to discuss a few topics about normality and categories and sites of it. So, categories and sites of normality. Okay. What is normality? It is often defined as a pattern of thoughts, feelings, or behavior that conforms to a usual, typical, or expected standard. So what we can say is that whatever is normal or acceptable, it is normality. So one dilemma in the study of normality is that in most cases, no formal rules or standards indicate what conditions are normal, unlike the study of disease, in which relies on the presence and absence of symptoms or crime, which can be defined in the relation of the body of laws. So that's the dilemma in studying also in this normality. And whatever it is in the opposite of normality, so it is considered as abnormality. So, for example, if you're going to eat your meals, so that is in line with normality. If you're going to eat sand or stone or rocks or whatever or trash, so that's no longer normal because that's not an expected standard. So, what factors influence what is considered to be usual, typical, or expected standard? So, your all thoughts, feelings, and behavior originate from a cultural context. So, a normality, if you have feelings with an opposite sex that is married, people will judge you as an abnormal. It's no longer normal in our laws. Or you have feelings with the same sex. So in our standard or the expected standard, it is no longer normal. So the specific situation or context in which a thought, feeling, or behavior is expressed in, and the quality of an individual's functioning in different situations in everyday life. Okay? So these are the categories that often refer negatively in the society nowadays. Gender, either of the two sexes, especially when considered with reference to social and cultural differences. So we have in our cultural context, we have only two. So other people in our society will judge those belongs to the third gender or the homosexual. So they are the categories that are negatively judged by the society. Age, so the length of the time that a person has lived or being existed. So if you will not act on your age, your society will judge you as an abnormal. So for example, you are already 30 years old or 35, and you don't act on your age, you're so immature and childish, so other people or the society will judge you as an abnormal. So that's why race, it is a grouping of humans based on shared physical or social qualities into categories generally viewed distinct by the society. So there are lots of racism in the world right now, especially for Asian, because as you observe, in other countries, they are being judged as the carrier of the virus. Ethnicity, the fact or state of belonging to a social group that has common national or cultural tradition. So, like this one also, like the tribes. So, and based on their education, based on their knowledge, they are being judged by the society as normal. So, that's why that that belongs to the categories that the society is referred to negatively. So this one, it is being stated in the book, the female sexuality is recognizable in terms of notion of normality, and anything that differs the norm is considered pathological. So pathological means it's an extreme in a way that it is not normal or that shows illness or mental problem. So what do you mean by pathological again? The extreme. So it is no longer normal. So the example is frigidity. It's no longer considered as normal if it is failure of female to respond in sexual stimulus. So kumbaga manhid at wala nang nararamdaman. So if a couple, are having good days, so if the female will no longer respond, it is considered as pathological. It is no longer normal. This one is nymphomania, an increased and therefore disturbing sexual desire. So if a woman, sobra-sobra na yung sexual desire niya, like, that word, it is pathological. So it is no longer considered as normal. These categories, according to the author, is that these categories and the many others that are employed in institutional sites such as clinics or hospital, or which have passed into general social field and are employed in the media, more or less determine both what we see and how we evaluate it. So again, female sexuality, it is a category that recognizable in terms of the notion of normality. If you have feelings with the same sex, or the example in the book, it is no longer considered as normal. So, next is the gaze. So, gaze is associated with the normalizing visual regime. It's not only meant to discover the truth of the world through the process of observation, analysis, and diagnosis and prescription, it also works at least theoretically to shape it. So usually, doctors, medical practitioners, they will gaze at someone and the patient. Sometimes you will look in the eye and the way they look at you. Sometimes they will ask you about this and that. So it is normal when they are just doing their job, right? Like looking at you when you are naked because they are checking if you have a disease, the skin disease, or anything that is not good for you. So, in other words, the body looks different when located in, created by, and the sites and techniques of science. So, what I learned from this lesson about normality is that in our society, others are others' perspective is different from other also because we base on our ways of thinking and the way we look at the things that we considered as normal. So sometimes if, if we think that is normal for us and the other people are not thinking that is normal, so they will judge us as being abnormal. So acceptance, yes, acceptance is the key. And that's all. And I hope that you learned something from my report or my discussion. Thank you and have a nice day. God bless everyone.